icy, but I think if we stay in the grass, yeah, stay in the grass, we'll be all right. She's like, I'm fine.
I'm really hungry.
Okay, I'll get you a sandwich. Horsies are in the other swing.
We're here in Cornwall, and this year the health insurance premiums for many Americans are going up. Today we're going to talk to a family of 4 who are experiencing that.
This is huge for us, you know. So just in premiums this year, we'll be paying $31,464. So we're paying more for health insurance than we are for our house. Elaine, you want pickles and mayonnaise? Take that as a yes. My equipment all goes in the back with all the car seats. All of my injectables are up here. My husband and I both work full time. I'm an equine veterinarian. I do ambulatory field medicines. I'm working around large animals that are very dangerous. And my husband is a dairy farmer. He also works with 1,500-pound animals every day. Come up, step up. The risk of injury for both of us every day at work is substantial. Not having insurance is not an option for us. This might take some time. If I want to have another baby or if we have some medical issues with more than one of us, we would be paying $51,764.
We also spoke to Owen Foster, chair of the Green Mountain Care Board.
We've seen health insurance premiums in Vermont spike between 40 to 60% cumulatively over the last 5 years. The cost of insurance is so high that people truly simply cannot pay it. So if you think about the average income in Vermont for a family of 4, if you have to pay $30,000, $40,000, $50,000 in insurance, you just can't do it. We are hearing and seeing data indicating large numbers of Vermonters are dropping insurance. That has a number of negative ramifications, one of which is that there's less people to pay for care because they're going to avoid care as they don't have insurance to cover it. It also makes people potentially sicker as they avoid going to the doctor because they have to pay out of pocket.
We met up with Burlington resident Jo Robinson. She is uninsured and recently fell on the ice and rang up some high medical bills.
Better this than the crutches. They're a nightmare.
I'm employed. I'm between insurance coverage. I broke my ankle. Yeah, and my foot. And it took me a few minutes of nausea, and I said, you got to call an ambulance. They did seem to react when I said I was uninsured. They said, oh, you have no insurance? Ambulance took me to UVMER. I think it was close to $4,000 initially, but as a self-pay, they call it, I had a 45% discount. It doesn't include the ambulance ride. I'm still not sure. The best estimate I could get was $2,300. But if there wasn't discounts or financial, we're looking at $6,000 to $8,000, somewhere in that range, which is wild. It takes one major injury for somebody's entire financial world to collapse. I obviously can't work. I'm in food production. I can't work in this state.
The financial strain at the hospitals and providers, if they have people that come that aren't insured, it's what's called bad debt or free care. They have to provide the care anyway, and it will hurt their solvency.
The process of care and charging and payment, all of this stuff is so complicated that nobody really seems to have a firm grip on exactly who's paying who, when, and how.
We've already paid our $1,000, I believe.
Yeah, well, or whatever. I mean, we just assume we're going to pay it every year.
Costs across the country have exploded, and I think part of it is the system has become so complex that there's just a lot of administrative costs associated with our healthcare system in and of itself.
We met up with Ellen Repstad, a Bristol resident who is a self-employed therapist.
So this year, the least expensive plan that was available to me was a bronze plan on the MVP, and the premium was almost $900 a month, and the deductible was $10,000. Did some research and decided that ultimately, financially, it probably made more sense for me to go without insurance and gamble, really, is what it is, because I'm counting on staying healthy. People ask me a lot, well, what happens if you have, an accident and you end up in all this debt? And I want to point out that a lot of these horror stories of people in tens and thousands of dollars have health insurance. My biggest fear is not that we lose the health insurance companies, but that we lose hospitals.
The Vermont healthcare system has been extremely strained for a number of years now. And what I mean by that is a lot of our hospital system is struggling financially to stay solvent. We have 8 out of 14 hospitals in Vermont with negative margins, which means they lose money just keeping their doors open. At the same time that we have that problem, the mental health providers, long-term care providers, and others, we have an insufficient supply of those physicians and providers to give us care. They're also financially strained. The insurance company, Blue Cross Blue Shield, is our dominant insurance company. Last year they had very, very acute risks of insolvency themselves, which would mean that they can't pay for the claims. And if the insurance company can't pay for the claims, the providers can't stay open. Vermonters pay some of the highest insurance costs in the country. So the amount that we pay for premiums to get healthcare coverage for insurance companies is arguably the highest in the United States of America. And it's been increasing exponentially.
A month or so ago when there was the government shutdown about this, I remember my husband being like, we've got to pay really close attention to this. The only times I've hit my out-of-pocket was the 2 times I had a baby. We're most likely not going to have another baby for a couple reasons, but this certainly is an important consideration.
You did your bad boy.
You know, I've had a lot of people say, oh, with premiums that high, it makes more sense to just not have insurance and do a health savings account. There's no possible way I could save up enough in a health savings account to cover a catastrophic medical bill. And so we built the house ourselves. My brother is a timber framer in Maine, and so it was all done in between chores, you know, like 10 a.m. to 2 every day. We cannot risk having this taken away from us because we built it with our bare hands.
Vermont is in a situation where we're at risk of a number of factors coming together and coalescing at the same time that could create what people call a death spiral. And what they mean by that is that health insurance costs so much that the healthier and healthier lives, the people who don't really need health insurance, they just drop it all together. And that thereby makes the people staying in the market who have to have it, people with chronic conditions, cancer, diabetes, type 1 diabetes, it just makes it so expensive for those people because you don't have the healthy lives balancing out.
You don't get billed the same amount when you're cash pay as you do when you're an insurance patient. I learned that you can comparison shop services. I had an MRI last year through UVM, cost about $5,000. Had I been a cash pay patient and gone to UVM, it would have been a little over $3,000. Had I gone to Vermont Open Imaging, it would have been about $1,700. Different meds cost different amounts in different pharmacies. I feel so much more empowered as a patient, in part because now insurance can't deny a service for me. I think I had this misconception and this fear for a long time that if I didn't have insurance, I would never get access to healthcare and I'd get sick and die. You know, you do the catastrophic thinking. And what I've realized as a cash pay client is I still have access to not only good healthcare, but more healthcare. I think it's important to mention that what I've done financially is the premium I was used to paying that was already budgeted, I'm still paying to my own savings account to cover medical expenses as they come up.
As our system needs more money, the hospitals and the doctors, if there's fewer people getting insurance, there's fewer people to pay them. There's more people with free care. And that really strains there. So you can just see all of these things coalescing at once creates a system-wide domino effect that is very, very risky. And that's what the Care Board as a regulator is really trying to balance. Really improve affordability for healthcare, but not be so disruptive that we're going to lose a hospital or lose a really important provider. Right now, the system needs time. The system needs time to change. And the state of Vermont, to its credit, recognized this over 5 years ago. We have got to do dramatic reforms on our healthcare system, just like in education. The positive here is that the governor's office and the Agency of Human Services just received a grant from the federal government for $200 million a year to do exactly this work.
Well, we know Medicare is a successful program, and people like Bernie have been screaming for decades, Medicare for all. It's already running, it's designed, it works.
Preventative care is like, that's where the investment needs to go.
System-wide transformation won't happen overnight. You can't create ambulatory surgical centers with a flick of a switch.
I'm not giving up on my healthcare. I'm not giving up on my health. I am just giving up on the insurance industry.
Not everybody understands how serious this is. I think they're going to when people start getting their bills. To pay for $51,000 for something seems like you're paying for a luxury or a privilege, when I'm really just paying for what should be a human right.
I think in the next year, we'll probably see the effects of these increased premiums as many Vermonters go without health care.
You know, responsibly, you need to have this money available if something happens.
Crazy kitty.
It's a crazy kitty. They could knock over, you know, some sort of priceless heirloom, you know. And the price of cat food and litter, I'll tell you what, like that's our biggest budget right now.
Let me tell you, and you can't write it off.
No, you can't write it off.